So, hi everyone, a very good morning to all of you. And I am Dr. Sumair in the daily transform session at the morning 10 a.m. And Dr. Diti will be joining us in a moment. And I have a very important agenda today. And that agenda is I want to know how to do an analysis of a grand test. And I also want you to discuss with me that how should we approach a GT at this stage. First of all, I wanted to ask all of you, and I wanted to ask you all, truly, and I want you to be very truthful in your answer. How many of you followed my advice of giving the GT 54? How many of you advised, follow when I said you have to give the latest GT, the 54 GT on the app? How many of you gave the GT? Okay, anyone can tell me how many of you gave the GT, and we'll talk about how to analyze the GT, what are the things that we should look at. And so Jamin has given the GT, very good. Roshan Nara Chaudhary has given the GT, very good. And Vanshika gave it, very good. We RR also gave it, very good. So I am very happy that you are following it. Okay. Pallavi gave it, Maitri, very good. Divya, Mehak, very good. So my second question to all of you is, now you gave it. Now my question to you is, how many did you attempt? So Aditya just joined in. How many did you attempt? And how many did you get correct? Okay. So now you have to type in the comment box and tell us how many did you attempt and how many did you get right? What was your number of rights and what was your total attempt? Okay.
Okay, I see someone saying 180 attempted, then 198 attempted.
Okay.
Okay.
Can you write in a single message attempt and correct? So I attempted 190, correct how many? So like I see 198 attempt, 139 correct. Jamin, very good. Tanushri is saying 183 attempt, 123 correct. 165 attempted but not telling the correct. Okay, so please give the answer in that format that I've asked you. Okay, so now what I'll do is we'll start with the number of things that we needed to talk about today. So first of all, I want you to promise to me that just like you did this time, you will target the latest JAMS GT and you will target at least one GT every 30 days if you're a 2026 or a 2027 aspirant. I'm adding a line for the INICET aspirants in November. आपके लिए per week है, मैं पहले ही बता चुका हूँ. You have to give one per week. I've done a
Yes.
separate video on you. One per week. But
And I will just like to add here that
once every 30 days.
for everyone who is appearing for November INICT, coming Sunday we will have a new INICT mock test paper for you, right? So we want you to alternate one GT and one INICT mock. So last Sunday it was GT 54. So this Sunday it is going to be INICT new mock test paper. So anyone who's appearing for November INICT should give the mock test as well. Okay.
So first of all, I wanted to talk about the frequency of giving a GT. So first question to all of you is, you have to break the barrier of fear. You are afraid that my syllabus is not yet over and nothing doing, whatever may be going on, you have to give the GT once every 30 days. If you are a 2026, 2027 aspirant. There will be a time where we will come live and say, "Ki boss, increase the frequency to 15 days." There will be a time in future where we will come and say, "Ab 7 days pe aa jao." And there will be a time when I will come and say, "Every 3 days aa jao." As of now, it is going to be once every 30 days, and you have to type promise in the comments so that I can move forward. You have to type promise in the comments. I promise the next
Yes.
30 days. We will
You
also
know,
keep giving targets.
irrespective of what is number of correct in this GT, irrespective of how many subjects you've covered, irrespective of whether you have revised something or not, right? Every month, a minimum of one GT has to be given starting now. And that's a promise that we want from all our students. We want you to commit to this because this one single habit we will show you will make a difference in your preparation, right?
And our goal is that we want to make sure that you come back next year on this channel and say, "Sir, जो आपने बोला था वो काम आया." We want to do that. Okay. My question to you is, why do you give a GT at this stage is to build the habit and also to touch all 19 subjects at least once a month. Otherwise,
Yes.
you tend to forget the subjects that you've done in the last month. You have to touch all 19 subjects in a month by appearing for a GT. Now I
So
will
this
take.
this also solves a very important query. Sometimes students will say, "Ma'am, I have covered 7 subjects, 8 subjects, but मुझे ऐसा लगता है जो सबसे पहले पढ़ा था मैं वो भूल गया हूँ." Right? And this is exactly why we want you to give a GT. It is like a passive revision every single month of all 19 subjects, and it is in the format in which it is asked in the exams. Right? So that is why
Okay.
we
Yes.
must give it at some minimum frequency.
Yes. So I hope it is clear to you that you give a GT even if you are a 2026 or a 2027 aspirant. You give a GT every 30 days to be in touch with all 19 subjects. Number two, I want you to understand is that when you look at the comments above you, you will see different number of students in the same grand test have attempted different number of questions. My question to you is now, okay, now what we'll do is I'll ask you a query. How many of you attempted maybe less than more than 190? How many of you attempted more than 190? Okay, that's very important question. How many of you attempted more than 190? Okay, maybe I can start up something. Okay,
I think
so
some of them might have, but I
okay.
just saw.
How many of
Uh,
you attempted more than 180, 170, 160? Start, introspecting. Now, for the people who have attempted less than 150 or 140, can you see there are other students who are writing in the comments that they could attempt 195 or 188 in this particular paper? Now, if you have attempted less, was it because you did not know anything about those questions, or were you too lazy to, think about a subject that you have not studied? So let us ask Sujit now. Sujit, you attempted 160, okay? और एक बच्चा है V 135, 165, okay? So क्या मैं आपसे पूछना चाहता हूँ कि बेटा वो जो हमने 40 अटेम्प्ट नहीं किए, क्या वो 40 होते इसमें कोई आइडिया नहीं था, या वो सब्जेक्ट अभी क्लास में नहीं हुए थे तो आई वाज लिटिल लेजी कि अभी क्लास में होने देते हैं एंड आई वाज जस्ट पासिंग देम आउट? क्या वो उस पे एफर्ट कर रहे थे कि नहीं कर रहे थे?
yes. Meanwhile, while they write this, you have to understand that it is a competitive exam. Unlike, other exam where maybe you just have to pass, you have to get some minimum marks, where, it may not make a lot of difference in the number of attempts. But please remember this, when we are talking about a competitive exam, it is very, very essential that you go aggressive on the paper. Okay, so 180 plus तो जरूर ही करने हैं even in the real exam. And if you see that when you talk about toppers, and I'm not just saying rank 1 to 10, I'm also talking about top 500 people, top 1000, 2000 people, you will all see that they have aggressively attempted the paper. They have probably gone beyond 185 and maybe even 190. Now, as I see some of you are saying कि मैम वो सब्जेक्ट हमने कवर ही नहीं करे थे तो आइडिया ही नहीं था. मेरी एक रिक्वेस्ट है आपसे that you have time
No,
bound section.
I want to take this query, Dr. Deepti here.
Okay,
एक
go ahead,
बच्चा
go ahead,
जिससे
go ahead.
मैंने वो पॉइंट पकड़ लिया, वो बच्चा कह रहे सर आई डिड नॉट टच पीएसएम क्वेश्चंस एट ऑल. एक बच्चा कह रहा रोशन आरा आई डिड नॉट स्टडी सम सब्जेक्ट्स सो आई डिड नॉट सी देयर क्वेश्चंस. Now this is the mental fitness that we are talking about. Now suppose in the exam or a GT you have a question that you have no idea about, just because you maybe if you had put that effort you could have seen some logic and your number of corrects would improve, your confidence would have improved.
I want to add something to this. I have interviewed many, many toppers over last 25 years. I mean, we have a huge legacy. And the point where I classically get their attention is that when they say that, man, kuch question hame bhi nahi aate the. But when I started looking at the options, मेरी basic knowledge से I was able to rule out and I still went ahead. So this is what is the art of trying to reach to the topics which you might not have covered now, but maybe by your basic knowledge you are still able to rule out. I'm not talking about factual questions because it is all or none. Either you know the value or you don't know the value, right? But other questions which may be short clinical, some applied, some longish options, मेरी एक रिक्वेस्ट है, इवन इफ यू फील कि ये टॉपिक आपने नहीं पढ़ा है, please at least see the options. It makes a lot of difference. ठीक है, अभी डॉक्टर सुमेर आंसर करेंगे, फिर मैं भी आंसर करूंगी. डॉक्टर सुमेर, हमारी बच्ची है तनुश्री सेइंग, मैम बट अगर हम ये करते हैं तो हमारी एक्यूरेसी बहुत कम होती है.
So, I was expecting this question. So, what is the correct parameter to be looked at after your GT? Do you look at your wrongs or do you look at your number of corrects? Do you look at your negatives or your positives? So, the correct answer is you always look at your number of corrects. You do not look at the negatives that you have done. You only look at number of corrects. I'll tell you how. I will tell you the approach that I follow. Today in this GT, maybe you appeared on this GT with your defensive approach. In the subsequent grand test, I want you to go in an aggressive approach. Aggressive का मतलब ये नहीं बेटा इंकी पिंकी पोंकी पो, नहीं. Aggressive मतलब try to find some
Educated
logic.
guesses. Yes.
Make an educated guess. जैसे मैं एक बात बताता हूँ, सपोज करो you were appearing for a PSM question, तूने पढ़ी नहीं थी. उसमें कोई क्वेश्चन ऐसा होता है कभी कभी जिसका एक लाइन सुपरलेटिव लिखा होता है. 100% of these patients can be prevented by this approach. Nothing like this really happens. You know this. 100% बता तो अपन डॉक्टर ही क्यों बनते? You agree or not? So there is always a probability that we will have some choices in which the language itself might be able to help you to rule out. There will be some questions in medicine where you may not know the medicine of it, but you may know the pathology, microbiology, or physiology of
Pharma.
it. You can rule out pharma,
Physio.
some choices. Now, in the second GT, one GT you give defensive approach, one you give aggressive approach. See your number of corrects.
Yes.
Again, follow the same approach in the next two. Gradually, you will not need me to tell you. You will find your sweet spot. You will find your sweet spot. Ki what approach really increases my number of corrects? Are you able to understand this? Okay. And also, it also helps you to train your brain to recall. Like I see, बच्चा कह रहा है सर मुझे पता तो था क्लास में बताए तो थे लेकिन मैं भूल गया था. So now when you are appearing for your GT, you're forcing your brain to recall into the conscious memory what you have studied. Every time we try to force the recall, gradually it becomes a habit, and in the exam it will become a reflex answer that as if you knew it by your spinal cord. You have to get into the act of recall. Okay, and you have, Tanushree, my answer for you is you have to titrate your approach till the time it becomes perfect. सारे स्पोर्ट्समैन ये करते हैं, सारे वॉरियर ये करते हैं, दुनिया में हर कंपटीशन से पहले यही किया जाता है. स्पोर्ट्समैन भी सोचता है कि मैं हर बॉल पे बैट घुमाऊं या किस पे करूं, किस पे पॉज करूं, किस पे डिफेंड करूं, एंड दे स्टार्ट फाइंडिंग देयर स्वीट स्पॉट. हर बॉल को डिफेंड करना भी सही आंसर नहीं है, हर बॉल को अटैक करना भी सही आंसर नहीं है. यू फाइंड योर ओन स्वीट स्पॉट बेस्ड ऑन द काइंड ऑफ person you are. You have to do this.
Then, also a very, very important thing is that when we are talking about how many correct, how many wrong, please understand when you see some questions which you don't know, you're not able to recall, do you feel it is unnerving? Yes. And you tend to lose concentration. And do you understand that this can happen in the real exam as well? So training your mind, even if you do not know, you have to sit there for 3 hours. You have to do the time-bound sections. You have to train your brain to not get fatigued. Okay, and it will come gradually. इसलिए हम बोल रहे हैं, irrespective of how many subjects you have covered, start giving GT every month, because the training of your brain is going to be a gradual process. It's not something which will happen in a day. So get accustomed to sitting there, maintaining your concentration, seeing the computer screens, even if it gives you a headache, even if it is dreaming you out, it is all part and parcel of the process. खाली सही MCQ नहीं करने हैं ना, हमें उस same environment में, हमें same methodology से, same concentration level से हमको paper attempt करना है, ठीक है? So
now
please,
I think you've hit the nail on the head. एक बच्चे का मैसेज भी आया हुआ है कि it is difficult to sit for 3.5 hours. बेटा तो एग्जाम भी तो वैसे ही होगा ना. एक बच्चा कह रहा है towards the last section I could not concentrate. Okay, एक बच्चा कह रहा है what feels simple while doing question bank feels hard in a GT. I hope now you understand why we forced you by
I want
I
to
put the nudging and everything के देना है बेटा. I know this is the game changer. From our videos every day, if you follow our advice, you will see that we'll nudge you onto different tasks and we'll try to make you learn the art of time management, stamina during the exam, thinking during the exam, and one that when the clock is ticking, एक ना ऐसा कई लोग बोलते हैं कि ना बहुत सारे लोग ना आर एबल टू डू वेल इन प्रैक्टिस, लेकिन जब घड़ी बजने शुरू करती है ना, टक 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 टक, सडनली व्हेन द टाइम इज रनिंग आउट, यू आर नॉट एबल टू परफॉर्म टू दैट लेवल. यू हैव टू अकस्टम योरसेल्फ. सो दैट इज द गोल ऑफ अ जीटी.
यस, सो वेरी वेरी एसेंशियल कि जैसे हम बात कर रहे हैं कि हाँ डीक्यूबी करना और जीटी करना दो अलग अलग बातें हैं. फॉर एग्जाम्पल, इफ यू रियलाइज आई एम गिविंग you every day a module of obstetrics to do from DQB, and I'm asking you to tell me your score. Now, this is a habit forming tool, right? But at the back of your mind, यार I will press a button. तो सही होगा और नहीं होगा कोई फर्क नहीं पड़ता. I'll quickly get the answer, right? So आप क्या करते हो? क्यू बैंक करते हुए आप उतना दिमाग लगाना नहीं चाहते हो. यू आर इन अ हरी, मुझे 50 करने हैं, 100 करने हैं, मुझे तो आज 500 क्वेश्चन करने हैं. सो द आइडिया ऑफ बोथ द थिंग्स इज वेरी वेरी डिफरेंट. ठीक है, सो व्हेन यू आर डूइंग द क्यू बैंक, भाई आंसर आ जाएगा, तो अब दिमाग ही नहीं लगाना है. लेकिन
वही
जीटी
सबसे
में ऐसा
इम्पोर्टेंट
नहीं.
बात जो डॉक्टर दीप्ति ने बताई है, व्हेन यू आर अपेयरिंग फॉर अ क्वेश्चन बैंक, द आंसर इज immediately revealed, and it is not training your mind to be patient. In the GT, the answers will be revealed after you finish the 200 questions, and that impatience, this impatience is your enemy. You have to become a patient warrior. कभी कभी आपने देखा होगा, जब you watch your web series and movies, the warriors or the hunters, they stay in the bushes for hours and hours, hour and hours, hours and hours, we're just waiting for the right moment. एंड उस समय पे ना, चाहे वो कितना भी अच्छा उसको निशाना लगाना आता हो, दैट इज नॉट द की स्किल. की स्किल इज तेरा पेशेंस. half the time the patience runs out, you're not able to focus, and by the time the prey comes, you're already out. You have to learn the art of patience. That is what the GT is. The second purpose of GT is to expose your weak spots, to find
एब्सोल्युटली.
what you think wrong.
ये तो बहुत मोस्ट इंपॉर्टेंट पर्पस है.
Okay. And for that purpose, I wanted to tell you something very important from DAMS. What we have done is we have done the game changing for many students who appear for GT because of the video solutions. Every DAMS GT, it takes us hours and hours of hard work, because we are not getting it from the student editors, we are doing it from the faculty. The faculty makes the paper. Our team is collecting with all the faculty members. They make the video solutions. They try to lay out the traps for you कि कहाँ तेरी गलती होगी, क्या PYQ है, and they try to predict. At DAMS, we take the pride in our strike rate. So I tell every teacher that, okay, we want to get the answer questions in the real exam. So let's think in those terms like an examiner. Think about the PYTs, think about the PYQs, and then make a video solution after the paper. So how many of
Now,
you saw the video solutions
and then,
after?
yes, I will definitely tell you about the wrong diary, but answer Dr. Sumay's question. That is important. Hanji, Dr. Sumay.
Yes.
So,
So my
sir is
question is,
asking,
how many of you attempted your video solutions after saw the video solutions in your mistakes? Okay. And also, when you are watching the video solution, the reason I am stressing more on the video solution than on the written solution is because when you do a mistake, okay, when you do a mistake and then you hear a teacher speak about it, it will create a permanent auditory memory. It will
yes.
create a permanent auditory memory for you.
So, I'm happy. So, Tanushri is saying that she was able to see 8 subject ka video solutions. Very good, Tanushri. You're moving forward, and I'm so proud of all the efforts that you all are making. Now, listen to me very carefully. Pehla, in the ideal situation, we should be at least listening to the video solutions of all the wrong MCQs. That is ideal. But now you would say, ma'am, I have covered only, let's say, 5 subjects in my classes. So I have a lot of wrong in other subjects. Now what do I do? So now for anyone who has not done the entire course, but let's say has covered only a few subjects so far, how should they be analyzing the grand test? For all of you, the minimum requirement is कि जो subjects आपने हमसे cover कर लिए हैं, at least उनके wrong questions के video solutions जरूर देखने हैं. ये तो minimum है बेटा जी. The ones that you've covered with us, उनका जरूर देखना है, and ideally all wrong questions. Now comes the second part. So, because, Dr. Sumer is very, very right. कई बार MCQ में what you lack is not the content, it is the approach. जैसे अभी किसी बच्चे ने ऊपर लिखा भी था, I miss keywords, I miss important points. Right now, when you listen to the faculty, for example, if I am giving you an explanation, I would always underline and say, did you guys notice the age? Look, she is 45 years old. Then I would say, did you see her complaint? She is complaining of vaginal dryness. Then I would say, did you guys focus on the FSH levels? It is 40. So it's a clinical question with 4 lines, right? And generally, every line, beta G, will have at least one keyword. Can you identify the 3 keywords I told you? I said 45 years. I said she has vaginal dryness, and I said she has FSH, which is 45. It is sufficient to come to a diagnosis. Do you know what it is? Premature ovarian. Not premature because she's 45 years of age, so most likely she is approaching her menopause. After 45 years, it is menopause anytime, right? The symptoms are of menopause, the FSH levels are menopause. So अगर एज में 45 कर दूंगी तो ये menopause हो जाएगा, मगर अगर एज में 39 कर दूंगी तो वो premature ovarian failure हो जाएगा. So do you see how age becomes a key factor in coming to what is the diagnosis? And it was just a small keyword. So this is what happens when you listen to the faculty, right? Because what we are going to do is we're going to teach you the art of identifying keywords. We will teach you the art of integrating them. We will teach you the art of how to rule out options. And they're all required. Once you have content building, इसके बाद ये करना ही करना पड़ेगा, ठीक है?
No, so when you watch the video solution after making a mistake, not before, after making a mistake, when you watch a video solution, you are hit by the idea that okay, ऐसे देखना चाहिए था, and it remains in your permanent memory. Every time we falter and someone tells us, वो memory ज़्यादा deep जाती है because there is an emotion attached to it. That emotion के मेरा ये गलत हुआ था. That emotion adds more value to the memory, and you're more likely to remember. Second is the most important thing that madam has just told you. Most important thing is keywords. The teachers highlight the keyword in their audio memory. वो ना मॉड्यूलेट करके बोलेंगे, बार बार बोलेंगे. जैसे मेरा होगा तो मैं बोलूंगा ये दिख रहा है सल्काई में ब्लड, sub arachnoid hemorrhage seen in the CSF spaces. You understand? So this is how the human communication happens. So whenever somebody is stressing on a point, your mind automatically knows this is something important he's telling me, and it saves it better versus you're reading in a monotonous manner. So please use the video solutions for your mistake. Please. And I keep seeing how much time should I give for review? Okay, let me answer this question. Vanshika, ये डिपेंड करेगा तेरे गलत कितने हुए. सपोज मेरे 100 गलत हुए हैं, it should take me 3 hours to look at the video solutions of the mistakes maximum. सपोज तेरे 50 गलत हुए तो हो सकता है 1-1.5 घंटे में ही हो जाए. You understand? It depends on the number of wrongs because you're going to look at the video solutions of the wrong. And also, whenever you're listening to the video solutions, please keep a copy with you. अच्छी सी सुंदर सी कॉपी ले लो, उसके ऊपर लिख दो रॉन्ग डायरी. मेरा और भी अच्छा मेरा आइडिया है, उसके ऊपर लिख दो माई रॉन्ग डायरी.
It is unique to you.
Okay, and in which you start jotting down some key points that the teachers are telling you. Don't become a stenographer and write everything. ऐसा नहीं यार सर ने ये बताया नहीं, बहुत अच्छा पॉइंट था, एक्स्ट्रा ड्यूरल ना सूचर क्रॉस नहीं करता, मैंने गलत कर दिया, दोबारा आ सकता है. जस्ट राइट एक्स्ट्रा ड्यूरल हेमरेज डज नॉट क्रॉस द सूचर्स. ओके, जस्ट द की बज पॉइंट्स. If you write too much, it will take a lot of time.
So
That means
what I usually tell
art
Dr.
of diary
Sumit.
making should be different from art of notes making. You're already written all of that in your classes.
So, Dr. Sameer, I will just tell them what I want them to follow. Now, suppose you have covered only 5 subjects with us and you haven't covered more. Pehli cheez, we will try and make a wrong diary from the subjects we have covered so far, not from the subjects that we have not covered. That is the first point. Second important point, suppose you've covered 10 subjects and you're telling me, ma'am, I'm not able to make the wrong diary of 10. I will say at least do bottom 5 subjects. जो भी बॉटम में आपके 5 सब्जेक्ट हैं, कम से कम उनका रॉन्ग डायरी करना है. अब रॉन्ग डायरी में क्या डालना है? पहला, प्लीज अंडरस्टैंड, अगर कोई फैक्चुअल मिस्टेक हुई है, the factual mistake can go as it is in the wrong diary. So what will happen is all your important facts eventually will be at one place, which will be like a super revision tool. Factual मतलब कोई value थी, कोई microorganism था, कोई investigation थी, कोई key finding थी, राइट? सो फैक्चुअल वाले वहीं पे लिख देंगे, ठीक है? दूसरी बात, व्हाट अबाउट द कंटेंट वाले, राइट? फॉर एग्जांपल इफ यू हैव डन समथिंग रॉन्ग, लेट्स से टू क्वेश्चंस, मैं हमेशा एग्जांपल देती हूँ, इट्स अ गुड एग्जांपल, इफ यू हैव डन टू क्वेश्चंस रॉन्ग इन पीपीएच, डोंट राइट इन योर रॉन्ग डायरी पीपीएच, because that means आपको पूरा पीपीएच पढ़ना है, which may itself take 2 hours. So no, that is not how you do it. In your wrong diary, you only have to specifically write the subtopic that you did wrong. So for example, in PPH, I will write, I have done AMTSL wrong, active management wrong. Usme bhi, I want you to actually identify what you did wrong, because only then you will improve. For example, I have written in AMTSL, I have done the names of drugs wrong, right? क्योंकि अगर आप नहीं लिखोगे, आप सारा पढ़ोगे और उससे क्या होगा, द एरिया दैट नीडेड योर अटेंशन विल एक्चुअली नॉट गेट द अटेंशन. योर अटेंशन विल बी डिस्ट्रीब्यूटेड ओवर so many other things and you are likely to make the same mistake again. ठीक है? So facts can go as it is, and concepts may you will just write very specifically the name of the subtopic that you did wrong. The last point, and then I'll hand over the mic to Dr. Sameer. Now, if you have made this from your bottom 5 subjects, I want that between this GT and the next GT, you will try and revise these subtopics from your notes. इतना मेरा goal होना चाहिए कि bottom 5 subjects, before I give the next GT, whatever mistakes I have done, I should be able to review them from my notes, especially if it was a content or a concept-based mistake. Okay?
You know, same thing that I would request even the students who are appearing for foreign medical graduate screening exam, and if you find your scores and number of corrects in your FMGE test on the DAMS app are, you know, stuck, I want you to develop this art. This is something which I call as art of thinking in the questions you do not know, which the toppers will call it as educated guess. This will be developed while doing a GT or a mock test. You should not be lazy on thinking of unknown questions. अभी समझने की कोशिश करते हैं, जब अपन ग्रैंड टेस्ट दे रहे हैं, एक क्वेश्चन है जो मुझे नहीं आता, अपने को लगता है छोड़ देते हैं. असली एग्जाम में इतनी आसानी से नहीं छोड़ पाओगे, जिंदगी डिपेंड कर रही है, करियर डिपेंड कर रहा है, तेरे को सोचना पड़ेगा. सो यू हैव टू ब्रेक दैट लेजीनेस एंड गेट इनटू थिंकिंग मोड कि यार मुझे नहीं आता, लेकिन मैं ऐसा क्या करूं जिससे मैं इसको कर लूं, ऐसा क्या करूं जिसमें इसमें से मैं आंसर ढूंढ पाऊं. क्या मैं कोई रूल आउट कर सकता हूं? कैन आई एलिमिनेट सम ऑप्शंस? कैन आई यूज माय नॉलेज ऑफ अदर सब्जेक्ट समहाउ टू फाइंड सम लॉजिक? कैन आई फाइंड सम गट फीलिंग ऑन इट? एंड देन यू गेट टू द आंसर. 3 तरीके हैं: एलिमिनेशन, गट फीलिंग, keywords, or maybe applying the logic of another subject on that question to get to the answer. You have to use all your common sense in the GT. ये जीटी में नहीं करोगे ना, और तुम सोच रहे हो कि असली एग्जाम में डायरेक्टली आ जाएगी, तो नहीं आ पाएगी. फिर क्या होगा ना, जो बच्चा जीत रहा है वही जीत जाएगा, तो उसको नहीं हरा पाएगा. यू अंडरस्टैंड? कुछ बच्चे होते हैं जिनको ये बात जल्दी समझ आ जाती है, दैट आई हैव टू पुट माई हेड ऑन टू इट. मुझे उस पर जाना है. जैसे इफ आई ओनली मेक दी, जैसे क्रिकेट में कहते हैं ना, जो सामने वाला बॉलर ने खराब बॉल फेंकी उन्हीं पे रन बनाऊंगा, तो मैं नहीं जीत पाऊंगा. आई हैव टू मेक रन इवन ऑन द गुड बॉल्स. I have to make runs on the good balls. So you have to use all your common sense, all your thinking in the questions, even if you don't know. Then you review your mistakes with the video solutions. Every passing GT you will improve. I just want you to imagine a graph and then I'll ask Dr. Deepti to pitch in. अगर सपोज करते हैं आज तेरे 100 ठीक है, अगली बार 100 ठीक है, अगली बार 95 ठीक है, उसके बाद 105 ठीक है. But if you follow my process, in the 5 GTs, you would have made 500 mistakes and heard the teachers 500 times that why not to make them. In the 6th GT, you will start getting 115, 120 correct. You will see a jump in your number of corrects. One more jump in your number of corrects will come when we start revising with you. When we will do the DVT, I will ask you to give a GT pre-DVT, 1 GT post-DVT. You will see a 20 question jump because of the massive bolus dose of revision that will happen. So revision and the art of thinking in questions that you don't know is the critical thing that can make your number of corrects jump from 120, 130 to 150, 160. That is what you desire.
Okay, I'll answer next thing, which will answer actually 3 queries together. The queries hai, what do I do about the subjects that I have not covered so far? Dusra query hai, how do we manage inconsistencies in score? और एक और तीसरा भी query था which is similar, not done yet. Okay, so please understand, when you follow the concept of wrong diary and bottom 5, what is going to happen is that जो आप subjects revise कर लोगे उनमें आपका performance better हो जाएगा. But in the next GT that you will give, some other subjects will come in your bottom 5. And if you follow this consistently, by the third GT, you will see a increasing trend in your score, because now by rotation, you are revising your weak topics in all 19 subjects. So don't worry, जैसे जैसे आप और subjects cover करोगे, this bottom 5 will keep changing and it keeps you on your toes कि भाई अब मुझे ये वाले subjects revise करने हैं, because they are now pulling the score down. Similarly, as someone said कि मैम अगर मेरे inconsistent score है तो वो क्यों हो रहा है? That is probably because in a particular GT, maybe the subject that you were weak in, उसके level of questions थोड़े ज़्यादा moderate difficulty के आ गए, तो उसमें क्या हुआ, आप lag कर गए. So it opens up your loopholes that maybe there are a couple of subjects in which your knowledge is very superficial. So when the question is superficial, you are able to solve it. But when the paper becomes moderately difficult, you start to lag behind. That is why not only you have to make a wrong diary and follow it, you have to do it consistently. You won't see the change after one GT. You would need at least 3 GTs. It's a kind request. Dedicate at least 3 GTs to your wrong diary. And by the fourth one, you will definitely see a trend like going up in your number of correct questions. Okay.
And I'll take a quick query. एक बच्चे query is, should we review GT on the same day or next day? Same day. Same day, beta, same day. Next day कभी नहीं आता. Okay. Keep this in mind. Whenever we say next day, it doesn't come. मेरे को आज तक जितने भी लोगों ने बोला हम कभी मिलेंगे, कभी नहीं मिले. जिन्होंने बोला आज मिलते हैं वही मिल पाते हैं बेटा. So today is the day when you analyze your GTs. Okay. Second is, you analyze, but you don't judge yourself. You analyze without shaming yourself. वो तरीका नहीं चाहिए मुझे, सर मैं तो 80 करेक्ट ला रहा हूँ, बहुत ही खराब हूँ, ऐसा कुछ नहीं है. You are a learner. Don't judge yourself. People who get rank 1, they also start at around 100 correct. But by following the journey that we have discussed with you today, by the time they reach their final exam, they reach to 180, 175 correct. That is the journey you need to build up. उस जर्नी में बार बार प्लेटू आएंगे. ये जर्नी ऐसे पहाड़ ऐसे स्लोप की तरह नहीं जाएगी. थोड़ा सा इंप्रूवमेंट आएगा, प्लेटू आएगा, इंप्रूवमेंट आएगा, प्लेटू आएगा. देखो मेरी तरफ देखो, इंप्रूवमेंट आया, प्लेटू आ गया. You listen to the video solution again and again, again and again. You cut out the plateau. Then you again increase. Then plateau. Then DBT कर लिया, पूरा रिवाइज कर लिया. You again have a peak. Then you do all the PYQs from your question bank. You will see again a peak. You will see a lot of bumps like this in between. Sometimes it will not be a plateau, it will be a trough. कभी कभी नीचे भी आ जाएगा. घबराना नहीं है तूने, घबराना नहीं है. सपोज करते हैं एक ग्रैंड टेस्ट तेरा बहुत खराब हो गया, बहुत ही खराब. तब क्या सोचेगा? तब क्या सोचेगा? तू सोचेगा अच्छा हुआ ये वाले जीटी में ना लगता है वो सारे टॉपिक आ गए जो मेरे मिस हुए थे. यू विल बी हैप्पी अबाउट इट, that these are my loopholes, these are my gaps in understanding, these are my blind spots which are getting exposed. I will do my best exam in the real exam. So wake up, let me know.
Okay, now just last 2 queries and then we'll wind up for the day. Number 1, yes, when you make a wrong diary, I give you the entire week. Video solutions की बात नहीं कर रहे, वो तो आप preferably उसी दिन देखो. But yes, for your wrong diary, you have to finish your wrong topics between one GT and the other GT. So even if you do it, like half an hour at night, 1 hour at night, you will be easily able to cover all those weak topics if you've written it specifically. Okay. Second, बच्चा is saying कि मैंने अपने notes बहुत पहले बनाए थे डॉक्टर हीलर ने 2020 में, और अब वो पुराने हो गए. डेफिनेटली पुराने हो गए. इट्स
बहुत
ऑलमोस्ट
पुराने हो गए बेटा. 2020 में कोविड आया हुआ था, वो भी पुराना.
डॉक्टर हीलर, आई विल जेन्युइनली रिकमेंड, आपने भी बोला आप B2B कर रहे हो, प्लीज स्टार्ट विद बिग सब्जेक्ट्स फ्रॉम B2B, क्योंकि क्लिनिकल सब्जेक्ट्स में ना सबसे ज्यादा चेंजेस होते हैं इन गाइडलाइंस, इन अप्रोच, इन मेथोडोलॉजीज, राइट? सो व्हेन यू आर बिगिनिंग, प्लीज स्टार्ट विद योर बिग सब्जेक्ट्स. कल सर ने भी बताया था देयर आर 6 or 7 बिग सब्जेक्ट्स, उनको जरूर आप B2B से दोबारा करो बेटा. इट विल रियली बी हेल्पफुल टू पुश योर स्कोर टू द नेक्स्ट जोन. ओके.
And also, whenever you're appearing for the DAM CT, you might have a query again that sir, ये difficulty level ठीक है, कहीं और करता हूँ उनका ज़्यादा मुश्किल है, किसी का आसान है. So you will always find that the difficulty level of our GTs will be same as your real NEET PG exam.
Yes.
It will totally resemble your NEET PG
Whether
exam.
it is GT or
You can trust,
CBT or
you can
mock.
trust the difficulty level. You can trust the difficulty level. मैं इसलिए कह रहा हूँ, अगर तुझे डैम्स के GT मुश्किल लग रहा है तो असली एग्जाम बहुत मुश्किल लगेगा. Okay, so because it is at the level of the NEET PG exam, it is at the level of NEET PG exam.
Yeah, in fact, if you hear from your seniors, you will they will say that the only platform which matches the real exam difficulty level is DAMS, GTs and CBTs. They are real eye openers. CBT में तो लगभग आपका स्कोर और नंबर ऑफ करेक्ट भी वैसे आता है फाइनल CBT में जो फाइनल एग्जाम में आता है, राइट? दैट इज हाउ क्लोजली वी मैच. नाउ आई थिंक
Okay,
वी
I
विल.
just wanted to add a line. I think कुछ बच्चे ऐसे हैं जो नवंबर का एग्जाम दे रहे हैं, उनका बार-बार मैसेज भी आ रहा है बीच
नहीं,
में.
रुको रुको रुको,
So
दैट इज व्हाट आई वाज गोइंग टू टॉक अबाउट.
don't forget to appear for the INICET mocks in the DAMS test series. They are designed just like the INICET paper. They are specifically for the people who are appearing the November INICET exam. Yes,
So no,
Gaurav.
tomorrow, Dr. Sumay, no, tomorrow we will dedicate the entire session for INICT November exam, right? Way forward, change of strategies, what you're going to do, right?
Okay.
So please join in tomorrow. Tomorrow will be the special session for November INICT, right? We will also tell you what special things we would do for all of you as well, and also take up your queries for your November INICT exam. Okay?
So tomorrow let's do a video on November 2025 INICET tips. I think those are the queries that we could actually see in the comments also. So let us do a special session tomorrow in the daily transform on the INICET tips. So be there at 10 a.m. in the transform session for that queries. So let us, because we want to filter out so that we can address different issues in a single video.
Chalo.
Okay.
I think we'll wind off for today then. So everyone keep working hard. Please make a wrong diary from your grand test. Okay. And try and review at least the bottom 5 subjects ke weak topics before we give the next GT. Okay. Chalo. Take care
And
everyone.
all I
Have
can
a wonderful
all I
day.
can tell you is all I can tell you is don't judge yourself on any scores. You are a learner. Look at every exam as a learning opportunity. Your life will be more easy. You will feel less stress and your ranks will improve. Wish you all the best. Keep transforming. We'll see you tomorrow at 10 a.m. again in the daily transform session. Wish you all the best.